Good evening, everyone. I know we're a little tired today, but bear with us as we present ARI preventions and community protections, and we might have a special surprise some of you saw last night. So, yeah.
So we're going to start by introducing ourselves. I'm Victoria Seltzer. I go to St. Thomas Aquinas, and I'm graduating class of 2024.
My name is Alvin Kishore. I go to Cerritos High School and I'm graduating class of 2024.
My name is Joshua Brown. I go to Battlefield High School and I'm graduating 2025.
I'm Luciana Rodriguez and I'm from Briolanda High School and I'm the graduating class of 2024.
My name is Annalise Cameron. I go to St. Thomas Aquinas as well and I'm graduating class of 2024.
I'm Laura Trong. I go to Falls Church High School and I'm a senior.
I'm Noam Haile. I go to Bravo Medical Magnet and I'm class of 2024. So, ARIs are droplet transmitted diseases that primarily affect your respiratory system. The key to preventing the transmission of ARIs is to prevent and minimize contact with the droplets. Some personal prevention strategies include washing your hands frequently, minimizing time around sick individuals, and keeping up to date with your vaccines.
Safe cooking. Practices such as biomass burning and open burning release harmful pollutants such as particulate matter and toxic gases which can have severe health consequences. So it's imperative to have safe cooking practices. Environmental education. Raising awareness about the importance of personal hygiene practices, so individuals can be empowered to protect themselves and others from infections. Government policies. Implementing government policies to curb pollution from biomass burning and waste disposal, promoting personal hygiene practice through educating. The community can create a healthier environment.
Community-based interventions. So educating communities, whether that be through the village chief, schools, or door by door is very important. It's extremely important to go and spread awareness towards the prevention and explaining what ARI is necessarily, and that would help promote a healthier lifestyle and help reduce the prevalence of the disease. Media campaigns and public service announcements are also extremely important and super beneficial in order to help prevent these ideas and knowledge. For example, the Global Hand Washing Day, which was also showed in Nigeria, showed effectively distribution of information and changing people's attitudes towards hygiene. Workshops are also super impactful as making them family friendly, or specifically those for kids, is really important because it also helps educate everyone, not just a sort of age group or
So this is our workshops that we put together for the community. We came up with 4, some correlate with one another, which are the hand washing poster, which is basically a poster to ensure that community members are taking the time to efficiently wash their hands. While they're doing that, we came up with a song to make sure that they're washing their hands for the correct amount of time to really make sure that they're cleaning their hands effectively. And then we also came up with a hand wash simulation that we'll discuss a little bit later in the slideshow. And then we also created a ventilation storybook, which is kind of to educate the youth community about what precautions they should be taking to decrease their chances of attracting viruses or diseases such as ARIs.
Children and their parents will learn a song that teaches them how to wash their hands properly in a fun way. Children and their parents will also take home a handout to keep and use while practicing hand washing that has the lyrics and pictures that represent each step. Here's the video.
Your hands, keep them clean and you won't get sick. Wash, wash, wash your hands. Scrub your hands using soap and you won't get sick. Scrub, 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 scrub. Wash your hands 20 seconds with the soap. Scrub your hands. Wash then dry your hands off.
Okay, so to accompany the lovely song written by Josh, entirely written and composed by Josh, by the way, participants will start by covering their hands in paint, like fully, so they'll have full coverage on their hands, and afterwards they're gonna wash their hands with just water and no soap for 5 to 10 seconds, which is kind of to mimic the casual way people wash their hands, even here in America. They don't do it very thoroughly, right? And this still allows microbes to live on your hand that can cause you harm. So after they do that, participants will then discuss what they notice about their hands. Do they feel clean? Do they look clean? Do they still have paint on their hands? Once they finish that discussion, they will then rinse their hands in paint again. And then this time they're gonna wash properly, thoroughly scrubbing their hands for 20 seconds with soap under running water. And then they'll facilitate another discussion and see what changes they notice this time. And the whole point of this practice is to show that, yes, the paint will definitely, they'll be more present on the first wash, right, rather than the second wash. And this is kind of to show that you need to have proper hand washing in order to get rid of microbes.
Okay, so first off, when it comes to prevention, awareness isn't enough. You need action. So our next exercise, exercise 3, is a storybook. And what we really wanted to highlight with this storybook is actual action that could be taken to prevent ARIs. And we wanted it to be memorable because we wanted it to be something that stuck with people, that was easy to remember. So therefore, we decided to do a story because throughout human history, we've used stories to convey important information for survival. So we decided that a story would be a great way to help people remember how to prevent ARIs. And we also decided to make it visual as well, just so that helps with the memorability of it. And yeah. And I'll read the story out. Musa cooked with an open fire in his house. This caused Musa to breathe in too much smoke. The bad air caused Musa to be more likely to catch ARIs. So with this, we wanted to highlight an important part of prevention of ARIs that can be prevented without having to use too much resources. Because the problem is, a lot of times people are aware of things that they can do, but they may not necessarily be able to afford it. So we wanted to highlight a way that people can prevent ARIs that could be free without cost. So just highlighting that you can, cooking inside, stopping from cooking inside can help prevent ARIs. And then the next one is, Obi never opens his window. He never lets fresh air in his room. His sister, Choma, coughs in the room. The little fresh air causes Obi to be more likely to catch an ARI. So this just kind of highlights how good ventilation can help prevent ARIs, and if you don't have airflow coming in, it can make you more likely to catch ARIs. And we tried to do it in simple language and use animals because our target audience are kids. And having a story that involves animals just makes it more entertaining and more memorable. Yeah. And then this is the last part of the story. We wanted to keep it short and simple just because little kids, their attention spans aren't that long. So Samuel keeps his window open. Because Samuel lets in fresh air, he can stay healthy and avoid ARIs. So you can see the contrast just within the pictures, how the first 2 visuals show the animals laying down. They don't look lively and happy. But this visual shows an elephant, he's happy, he's in the room, and you could see his windows open, he lets fresh air, and that clearly gives the message that good ventilation can help prevent ARIs.
So we have our itemized budget here. So soaps, we're gonna order 51 soaps, that'll be $102 in total. Hand sanitizers, $100, that's 50 hand sanitizers. And we're gonna buy 100 masks for $20 and give 5 out to each participant. And in total, that'll be $222, and we're gonna donate the rest of the money to Nigerian hospitals.
So these are the handouts that we'll be giving to the people. First, we have a poster for them to take home. Again, this is just to ensure that they're taking the right amount of time to properly wash their hands efficiently. And we have the song lyrics that Josh wrote underneath each step, so they kind of know what part of the song they should be singing while they're washing their hands. I guess it's just like a fun way to remember how long they should be washing their hands for. And then we're also going to be giving out little bags to each of the members of the workshop that will contain hand sanitizer, soap, and face masks. These are just like simple necessities that one might need to prevent themselves from not only getting an ARI, but also transmitting it to someone else. So it's a good way to keep your hands clean, and also ARIs, many of the symptoms include sneezing, coughing, so you don't want to be near other people, and if you are, you want to at least have a mask on to prevent it from spreading to other people.
And these are our references, and I just want to say thank you so much to everyone for listening, and thank you to the amazing doctors here who have taken time out of their, month basically to teach everyone how to diagnose a patient and so much about public health. And I also would have met such amazing people without this program. So yeah, thank you everyone.